We're live. Got it.
Hello.
2019. Got a little bit, about 9 months.
Madam Clerk,
Good morning. Yes, sir, Mr. Chairman.
Are we about ready?
Madam Clerk.
Yes, I think we're ready. Rico, are we ready?
Yes, we are. If you drop the screen. We're live, Madam Clerk.
Mr. Chairman, we're ready.
All right. Good morning, everyone. Thank you so much for joining us. I'm Rob Pitts. I chair the Board of Commissioners of Fulton County. This is a call meeting of the Board of Commissioners. Today is January 7th, 2022. It is approximately 10:01 a.m. Madam Clerk, would you call the roll for purposes of a quorum of the Board of Commissioners?
Chairman Rob Pitts,
Present.
Vice Chair Liz Hausman,
Present.
Commissioner Bob Ellis,
Present.
Commissioner Lee Morris,
Present.
Commissioner Natalie Hall,
Present.
Commissioner Marvin Arrington Jr., Commissioner Khadijah Abdul Rahman. Mr. Chairman, you have a quorum.
Thank you. And would you call the roll for the mayors who are present?
City of Alpharetta, Mel Gilvin.
Present.
City of Atlanta, Mayor Dickens. Chattahoochee Hill, Mayor Reed.
Present.
College Park, Mayor Motley Broom.
Ken Allen for Mayor Pro Tem.
Thank you. East Point, Mayor Holiday Ingram.
Here.
Fairburn, Mayor Avery. Hateville, Mayor Hallman. Johns Creek, Mayor Bradbury.
Here.
Milton, Mayor Jameson.
Present.
Mountain Park, Mayor Steele.
Present.
Palmetto, Mayor Bodie.
Present.
Roswell, Mayor Wilson. Sandy Springs, Mayor Paul. South Fulton, Mayor Khalid. Union City, Mayor Williams.
I'm here.
Thank you.
Okay, thank you very much. We will proceed with the agenda. I haven't received one. However, I'm assuming we're going to be talking about a COVID update, Mr. Manager. We're going to talk about elections. And there's also an issue that we need to discuss briefly. That is the T-SPLOS Oversight Committee or Council that the mayors need to set up, as well as the board, and also the 2022 meeting schedule. Is there anything else?
No, sir, not that I'm aware of.
All right, and we'll proceed accordingly. The COVID update, you want to begin, Mr. Manager?
Yes, sir. Of course, we've been meeting for the last 2 weeks. This will be the third week in cadence. So I think this is a good discipline, particularly given kind of the ever-changing aspects of this. We briefed our board on Wednesday and reprised that briefing for you here today. So I asked Matt Kallmeyer and Doug Schuster to jump into this. Obviously, you'll see that the trends continue to be very challenging and are projected to worsen. So that's one takeaway. Also, you'll see that we do have home test kits that we anticipate being delivered, thought they would have been delivered earlier this week. And we want to discuss with you distribution of those kits, as well as the county's plan to match that number of kits with our own purchase. These first tranche are coming from the Board of Health, about 46,000, so we're trying to double that amount, in addition to the federal distribution of kits that will come as the 500 million or so kits being purchased are made available. And then lastly, we'll talk in this response about emergency rental assistance, getting the very welcome news from the DCA commissioner on New Year's Eve that our reallocation request of 25 million had been approved. Now we're waiting for Treasury to give us final guidance on that, whereby we can start to deploy those dollars as we've had previously. And again, I think that has been an enormous success story throughout this process, our ability to manage those funds and get them to our citizens. So with that brief intro, Matt Kallmeyer and Doug Schuster will give you the overview of our trends as they've been doing. So Matt, let me turn it to you first.
Yes, sir. If I may, Madam Clerk, it looks like the City of South Fulton Mayor joined us. I just want to make sure that you had a chance to acknowledge his presence, as well as Commissioner Abdul Rahman does have her hand up. I don't know if you, Mr. Chairman, if you want to go ahead and address her first before we get started.
I'm sorry. I just wanted the clerk to know that I am present. Thank you for recognizing me.
Yes, ma'am.
Thank
Yes,
you.
ma'am.
Before we begin, you may or may not know that Commissioner Arrington had surgery, I believe, yesterday. So I'm not sure whether he'll be on the line or not, but let's all think about him. I'll be speaking with him later on today. All right, Mr. Kallmeyer.
Yes, sir. Thank you, Mr. Chairman. Doug, let's go ahead and start our presentation.
Good morning, mayors. So our numbers continue to increase. We are at record highs for both hospitalizations, percent positives and cases, and we'll show that in the slide deck. We do have newer data on the Omicron variant is now at 92% of all cases in Georgia. 70% of all new cases are from the unvaccinated. 96% of all new hospitalizations are from the unvaccinated, and 96% of all new deaths are from the unvaccinated. This slide's 2 days old. I want to give some updates here because we did get a new EPI report. There is more breakthrough cases. We are now at 61% of all new cases are from the unvaccinated, and we now there's 7% breakthroughs going into the hospital. So we're at 93% of all people going into the hospital. Still at 4% for new deaths. So the number has changed a bit. Once again, the greatest protection is to have the booster shot, and we'll keep you hopefully out of the hospital. Fulton County hospitalizations have increased. Our pediatric admissions are higher than they've ever been. And 3 of our major indicators on the Fulton County scorecard are red. Next slide. So it's pretty stark from December 13th to January 4th. The condition of, the darker colors are obviously much more unhealthy and show transmission. And so you can see really kind of the breakout of Omicron. We have seen that Omicron started in cities with major airports and have spread to rural areas from there. And that's true certainly in the state of Georgia. Next slide. We are 15 times the recommended amount by the CDC for masking. The standard is greater than 100. We're at 1506. The standard for percent positives is 10%, and we're at 40% positives. Next slide. This just shows you what I talked about. Omicron is the purple, and it shows region 4 there. But specifically for Georgia, 92% of all new cases are the Omicron variant, 92.1. Next slide. This is what I was talking about earlier, where I have updated information. The blue on the top is the breakthrough cases. That number now has increased to 39%. And then the bottom left, you'll see the hospital admissions. That number has increased from 4 to 7% for breakthrough cases making it to the hospital, and the deaths remain unchanged at 4%. So there are more breakthrough cases. We all know evidence of that, but just remember 25 times more protection if you get your booster dose. Next shot, and next slide. Monthly, we like to show kind of what the monthly numbers are, and you can really see on this slide, if you study it, how deaths are a lagging indicator after we have a rise in heights. If you go back to December, January last year, and then you see the deaths increase January, February, March. So 23,000 cases, 400 in December. I hope that doesn't translate to a huge increase in deaths, but that's the trend that we've seen since the beginning of the pandemic. Next slide. We do have new data on this also. Every municipality is up over 800%, most of them over 1,000% from the previous week. And it doesn't spare any municipality in our district. It is all up significantly. Next slide. And really, I compare from BOC meeting to BOC meeting. So kind of incredibly, the 7-day average for cases is up 1,687% in that 3-week time frame. Percent positives, which is now 37%, is up 800%. And the hospitalizations are up to 1,110, which would make us about 800% greater than the last BOC. And the deaths are down, but remember, it is a lagging indicator, and we have had low deaths for the last 3 weeks with COVID as a comorbidity. Next slide. So you can see the red going up. I will say we kind of predicted last week that hospital bed availability would really start to drop after the first of the year. I don't have a slide to show you, but in the last 3 days, we've been in a shortage situation in hospital beds. It's not really beds, it's staffing of beds. And so, like I said, as expected, COVID patients, along with the COVID surge, has led to a shortage now that we're after the first of the year. Next slide. So you can see that we have tripled as of January 4th, our previous high last January 3rd. And it's almost been a straight up and down line. And we hope to get new data on modeling and update by Monday. The early modeling that I'm looking at looks like the peak will be about a week or two sooner. And so like I said, we'll update you as soon as we get the new data. But right now, that's where we are. The orange that you see is our most probable projection as of this time. Next slide. Just real quickly about our vaccination response. Matt, do you want to take this? You want me to go ahead?
I can do this. Just want to make sure that everyone is aware that we are still offering first and second dose vaccines. The total amount of vaccines that we have done between the Board of Health Fulton County joint team, as well as boosters, that is still a little shy of where we'd like to be to get to our herd immunity amount. So we're asking once again for your help in amplifying the message, as well as ability to go ahead and get boosted. We have a lot more availability at our sites we've increased the capacity, as Doug has shared, as well as the county manager. So please go ahead and help us get the message out. If you are eligible, if it has been 6 months since your second dose of Pfizer, please go ahead and come to our sites to take advantage of the booster shot. If you are 2 months after your Johnson & Johnson, please come in and get your booster shot as well. So we have Pfizer, Moderna, as well as Johnson & Johnson available. Take advantage of those things at our different locations. We'll still have 2 mobile units that'll be going out into the community.
Matt, you got a question?
I'm sorry. Normally we leave that towards the end. I apologize.
Okay, I'm sorry. It was just timely regarding the boosters and everything. So can you speak at all to what someone should expect in terms of their immunity buildup if they have had COVID, if they've had Omicron, what that does in comparison?
So immunity based upon a previous infection of an earlier variant, sir, is that what you're asking?
Yeah, so I hate to say it, but we had a COVID Christmas in my household, and everyone had luckily pretty mild symptoms. So just wondering, because it's just something that's being asked a lot in terms, obviously there are a lot of people getting this. So where does that leave them in terms of immunity or ability to fight off future infection compared to a booster or the vaccine, et cetera?
The scientific research has shown that the natural immunity you get is not as strong as a vaccinated immunity. So what is still being recommended is getting the booster shot once you get past your signs and symptoms associated with your infection from a particular variant. So I believe what Dr. Paxton would say if she was able to be here with us today is still take advantage of a booster. Please don't go ahead and think that you have a higher level of immunity because of that. You were just recently impacted with a particular variant. So the best way to go ahead and give yourself defense going forward from this is increasing your availability to fight off future variants of this virus. So ultimately, a booster shot is what is necessary, sir.
That is correct.
Excuse me, Mr. Chair, are we not acknowledging people that have their hand raised?
Okay, I cannot see. Can you?
Because the lineup has been Mayor Khalid. He's had his hand up for a while, and I have had my hand up for a little bit of time right now.
Mr. Mayor, Khalid, and followed by Commissioner Hall. I can't see, so.
No, that's fine. Thank you. We are having this discussion even as now the Supreme Court is hearing oral arguments about vaccine mandates. I was just wondering, do we have any morbidity or mortality data about vaccinated versus unvaccinated people, or any hospitalization data about vaccinated versus unvaccinated or unboosted person?
Can you go back a couple slides?
I believe slide 1 is where we had the moderator.
The circles.
I also want to take a
Right there.
acknowledge that Dr.
Keep
David
going.
Holland from our Fulton Board of Health is on the line. Dr. Holland, thank you for joining us. For those of you unaware, Dr. Holland is an infectious disease physician.
Keep going forward, please. Forward. You'll see this one more right there. So this is the data of breakthrough cases, Mayor. The bottom on hospitalizations, like I said, that new number as of Wednesday is 7% of breakthrough cases make it to the hospital, and 4% of breakthrough cases end up perishing at this time. That's taken 2 weeks at a time.
These slides will be available to us, correct?
Yes.
I do think that these are probably the most persuasive data in convincing people to get vaccinated. So I think just going forward, making sure that people have this data in a simple fashion would be super helpful.
All right, Madam Clerk, did you forward this information to each of the participants?
Yes, sir, I did, and it's also on our website.
Okay, let's make sure that everyone has what we're talking about. All right, continue, Mr. Mayor.
Oh, that was it for me. Thank you.
Okay. Madam Clerk, can you see the hands as they're raised? Because I can't.
Yes, I can see them. Yes.
All right, I think Commissioner Hall said that she was next. Commissioner Hall?
Thank you, Mr. Chair. As of our Wednesday's Board of Commissioners meeting, we had this presentation And there was something that was revealed to us that I want everyone on this Zoom to also know. As I stated at the BOC meeting, we know now that the protection offered by the vaccine has never been 100%. And now that's even more reason why the booster shot is important. So can you please share with everyone on this Zoom what you reported to us yesterday as it relates to the percentage of protection with 1 shot, 2 shot, and the booster?
So thank you, ma'am. I believe what you're referring to is the fact that we discussed the fact that based upon the current variant, the 2-shot dosing model that was initially gives you about a 50% immunity to the current variant. It increases it by 25% should you get boosted. That's why it's so important to get boosted. There is no vaccine that's 100% effective. I think Dr. Holland is spending his whole career trying to go ahead and change those type of statistics. But once again, we cannot stress enough that just because you get vaccinated doesn't mean you're going to get infected. The vaccine is what keeps you out of the morgue. The vaccine is what keeps you out of a mortuary home. The vaccine is what keeps you out of the ICU. And that's what it's doing. And that's what we're trying to continue to get people to understand is that, yes, you will get infected, but you will go ahead and have a milder symptoms. You'll be able to recover at home and come back into your normal daily living type activities. Dr. Holland, would you like to go ahead and comment?
No, the only thing I'd add is, 2 shots plus a booster is actually pretty good protection against Omicron, but as you pointed out, nothing's 100%. However, as Mr. Kallmeyer pointed out, and this, I cannot emphasize this enough, is that even 2 shots provide really, really good protection against hospitalization and death. And the booster adds even more protection to that. And, we're going to talk about, some other things, new medicines, monoclonal antibodies, everything. Vaccination remains the single best way to prevent severe COVID and death from COVID. Period. The end.
All right, so let me make sure that I'm clear. 2 shots offers 50%. When you add the booster, it adds an additional 25%, so it brings you up to about 75%. And people can die even if they are fully 2-shot and boosted if they have pre-existing conditions that lower their immunity a little more.
Be clear. Can, yes, but it's very rare.
That's what I'm trying to ensure, that we are very clear, because there have been so many of my residents in District 4 who have said, why do I have COVID? And why are some people dying from COVID who do have the 2 shots and the booster? And it needs to be clear, is because they have pre-existing conditions that may have contributed to that being the case. Now, also, I want to make sure, because, you can't believe everything you read in the media, but I've been reading that they're saying that people are going into the hospital for non-COVID related issues, then getting tested for COVID, because that is, of course, the normal procedure now. And once they're tested, it's being found that they have COVID, but that is not the reason why they initially went to the hospital. However, it has been found that the numbers have been skewed because of the fact that the test came out positive once they got there, and it's being said that they were hospitalized due to COVID. Can you validate that? Have you heard about that?
Well, as we track, and I talked to all the hospitals this week, that is indeed the case, as most hospitals test every patient. They're assuring me it's a very small percentage, and they still may get COVID treatment while they're in there for something else. But to the point, we still have 200 people in critical care units and 64 people on ventilators, which are still very, very high numbers. And once again, most of these, the lion's share, over 90%, 95% are from unvaccinated populations. So while the numbers may be inflated a bit because of that, and they're going to start hopefully tracking that separately, it's not a huge thing. And it's, COVID's everywhere right now. But I just want to reiterate that there are still some very sick people in our hospitals at very high numbers.
And my last question that I'd like for you to respond to, that I asked you at the BOC meeting, but I want to make sure our mayors and everyone watching and listening also gets this information, is how is COVID transmitted from person to person?
Dr. Holland?
COVID continues to be a respiratory illness, and it continues to be transmitted primarily person to person through droplet contact. And that, requires close contact. And this is why masking is important, because masking actually prevents people from basically spewing out the little droplet particles. There are certain circumstances where it can be transmitted through the air over some distance, usually in poorly ventilated, very close quarters type of situations. That's been documented. It seems to be not the major way it's transmitted. Surfaces have not emerged as a, as a common way for COVID to be transmitted. I'm not going to say that it's not possible, but pretty much every, way they've looked at it, it's been person to person droplets through the air.
All right, thank you so much. And I want to thank Matt Kallmeyer, Doug, Dr. Holland, and Dr. Paxton, and the Board of Health for all of your hard work. I commend you, because this has been very hard for everyone. And I can't even imagine the stress that you're under trying to keep up with everything that's going on and trying to help us serve the community. So thank you.
Thank you, ma'am. Madam Clerk.
Mayor Gilman? Mayor Gilman?
Thank you, Mr. Chairman. I just, hearing him discuss masking again, and that's been one of the most confusing issues over the past couple of years. And I know the CDC has recently, or others have made different statements lately. Could you please point out some of the studies we can use that show the effectiveness of masking in stopping the spread? Because I still haven't seen any clinical evidence of that. And it becomes difficult to convince some people without a clinical study or some documentation of that impact.
Yeah, there are some of those. There's some of those out there, and I'll have to pull them. But it's, I think a lot of people get confused about, what the purpose of masking is. And, there are ways to wear masks that, protect the wearer. But the primary purpose of masking is as what we call source control. So my mask protects you and your mask protects me. And that's, why it's important for everybody to do it. It's not just I wear it because I'm afraid of getting COVID. It's I wear it because I don't want to give you COVID. And
I understand the challenge we have is that there's no clinical evidence to show the impact that had. I've not seen any, and
okay,
I
can
understand you say it exists, but I've asked physicians who have asked me to create mask mandates, and I would ask them every time, please show me the study so I've got something to stand on, because part of the biggest issue we've had over the last 2 years is miscommunication, misinformation. And I think that's why we've got so many people that won't even get the vaccine now, because there's just been so much confusion. And so when I can point to scientific evidence, that's very helpful. But just making general comments about, oh, well, it makes sense that it would, or it can, and stuff like that, that doesn't really persuade people in this environment right now.
Sure, I can provide that for you. There's actually a number of them.
That'd be great. I appreciate it.
Anyone else? All right, Mr. Kallmeyer, Mr. Schuster, continue with your presentation.
Moderator, I need you to go to the slide where it had the 500,000 number in the top left-hand corner regarding bullets of where we are with vaccination and booster.
Page 13.
Thank you so much. So once again, we talked about the fact that we have 2 mobile units out there. We have been able to flex our program, increase capacity in the 60% range of our vaccinations, and add additional mobile units, as well as changing our fixed sites to a mobile friendly base, in the sense of if we need to get more of these trucks out into the community and we're starting to see a lessening in demand inside our fixed sites, we can do so. So it gives us a really more of like a Lego building block type of a kit as we move into this quarter of how we can go ahead and continue to achieve the mission. Incentives work. We shared this with you all in the past. About $250,000 have been spent from the ARPA funds thus far to go ahead and help with incentivizing individuals to get boosted. We will continue to do that, as well as working with our external affairs teams of both the Board of Health and the county to get that message out of why it's so important. I believe Ms. Jessica Corbett has some vax up, mask up, boost up type of language that she can share with all the communities to help amplify that message. And the Board of Health and the Fulton County have been pushing out on their social media channels over the last couple of weeks. So please help us amplify those messages. Boosters are approved for everyone over the age of 12, and that's for Pfizer. Please make sure, there's been some confusion with that as well. That's where we currently stand. Just because the FDA does one approval, unless it's followed up by the CDC approval, and finally has the blessing in the state of Georgia from the State Department of Public Health, that's where we have to stand. So that is where we are. As soon as additional things are approved and we get that blessing to proceed, we will do so. And we did talk about the 25 times more protective that Commissioner Hall asked us to go ahead and go into discussion with a couple minutes ago. So thank you. Next slide, please. We did touch on this earlier. Just want to draw a fact to the 38%, the bottom right-hand corner of those individuals in Fulton County that were fully vaccinated has gotten their booster. We're tracking that. So we're continuing to make sure that we want to see that number tick up, and we need your guys' help to do so. And the 61% fully vaccinated getting us closer and closer. We truly believe between ourselves and the Board of Health that that is what's helping us at this moment in time as we see this sharp increase in COVID patients in our jurisdiction. They are not the ones that are going to the ICUs and ultimately not having fatalities because of the fact that we have a pretty sizable sum of our population vaccinated. So that is definitely a positive that we can share together, that we did it with your help to get the message out, as well as the support of your teams. And we look forward to continuing to strive to get that number higher. Next slide, please. Next slide, please. Want to make sure that people know when we get the mobile team out there, what we really are trying to do is hit the low uptake census areas, as well as individuals of color. 81% of our program is still hitting that population and continuing to increase. And we are still making sure that we get the vaccines out to those sites. And we will continue to do that with the funding that we received to keep our mobile mission alive. So we thank the county leadership. We thank the Board of Commissioners for allocating those funds to us, and we'll continue to go ahead and showcase of how we're ensuring that equity is occurring in our jurisdiction. Next slide, please. You'll have this in your packet as just some sites where mobile teams are. We'll continue to work with you on that. Next slide, please. Doug did share with you all that we do have the fixed sites. The 63% increase is what I shared with you all regarding our capacity. Just want to make sure everyone's aware of it. Ms. Corbett from the External Affairs, as well as the Board of Health External Affairs team, put together a nice graphic, I believe, on Wednesday and distributed it that shows cases, all the sites, what their days of operation are and such. So we want you guys to take advantage of that. 3 distinct sites, the 4700 Aviation and Stonewall Road, as well as 2 health centers, College Park and Adamsville. And then we do rotate one of the mobile trucks down to the county building once or twice a week, if possible, to make sure that we can take care of the downtown footprint, as well as our judicial partners as well. So we'll continue to do that and making sure that it's flexible, offering nighttime hours. That has been a huge success over the last couple of months during the fall. We will continue to do so to make sure that each of these sites has a nighttime offering. So those individuals that cannot get there during the daytime. So we're not deaf to the fact that everyone cannot come during a work day, and we need to go ahead and make sure there's opportunities for folks to get vaccinated in non-traditional hours. That has always been our success. Back when we ran the community vaccination center, we'll continue to go ahead and do that as we move forward here as well. Next slide, please.
Commissioner Hall.
Thank you, Mr. Chair. I was going to wait until the end of the presentation for the vaccinations.
Okay, thank you, ma'am. Continue, Mr. Kalmar.
Yes, sir. We talked about the leveraging of the grants, the equity grant, and the actual COVID response funds from the ARPA funds that the county has and will continue to do so. I want to also just draw attention to the fact that the core epi team that the Board of Health funds right now with that 30% positivity rate, there's not much a success in contact tracing in the broader community. If you have a more controlled environment like a workplace, a school, things along those lines, it's much easier to go ahead and have effective contact tracing. But when you start looking at population wide with that type of a spread, 1 in every 3 cars that come through our testing site has someone that's COVID positive in it. So they have taken those units and those resources, reallocate them to a home testing and vaccination mission for people that are homebound. So congratulations to the Board of Health is being nimble as possible in that regard, and they are continuing to go ahead and support those individuals with that. That is pretty much all I have on this slide, sir. Next slide. And before we go here, I'll kick it back to you, Mr. Chairman, to see if you'd like to address Ms. Hall, Commissioner Hall's question. This next section will go into the home test kits for Dr. Rochelle's comments.
All right, Commissioner Hall.
Thank you, Mr. Chair. So a couple of extra questions came through from constituents. They want to know about the reinfection rate. Do we know what the reinfection rate is for the Delta and for the Omicron variants?
Dr. Holland, I don't know if you have any clinical data to share on that. I have not seen anything come across my desk per se. I wasn't sure if you did.
I don't think it's possible for us to separate it out for Delta and for Omicron like that, just because we don't test every single, isolate that comes through. It's a very small subset that actually get typed. But it is definitely higher with Omicron than it was. The reinfections that we're seeing are, higher now than they were in the summer when Delta was the predominant one.
So do you have a percentage of
No.
how many times people are getting COVID repeatedly?
No, I don't. They only started tracking reinfections. I don't even remember when. And I'd have to go see if that's on the DPH website, if they report that.
Okay.
But no, we don't have, I don't have like a,
You don't have okay, but we just only know that people can get it repeatedly.
I wouldn't say repeated, like they can get it more than once. You can get it more than once.
Repeatedly. I mean, if you
very low numbers. And the state doesn't put it on their website because there's no significant amount of people that happens to.
So do you have a percentage then, since you know that it's not significant, Doug?
The state has just told me that the number is not significant to track. That's all that they gave me, because they're not huge numbers. So there's not, it's probably less than 1%. Would be my guess, but I don't have the data exactly. They just said it wasn't significant enough.
Okay, well, we don't have the data, but we know people can get reinfected, meaning they can get it more than one time. And so the other question from a constituent is, can you tell us about the new variant that was recently found in France?
We don't have a lot of data on it yet. It's just one that's popped up. Not all of these become variants. Sure. So not a lot of data on it yet.
All right, thank you so much.
All right, Mr. Kalmeyer, continue.
We're going to kick it to Dr. Rochelle, sir.
Dr. Rochelle, you have the floor.
Good morning. I'm sure many of you by now have heard reports of inability to access at-home test kits, high demand for at-home test kits. The purpose of this information today is just to provide an overview as to how Fulton County is stepping up to fill this gap, how we will partner with the Board of Health on their initiative to fill this gap, and what we are expecting from the federal government as it relates to the provision of at-home test kits. The Board of Health has procured 46,000 at-home test kits through an equity grant. We are expecting delivery any day of those test kits. They will be distributed through a variety of mechanisms. We are partnering with the Board of Health team to distribute the test kits at local libraries through direct to consumer for those consumers that really simply cannot get to a distribution site, as well as community-based organizations and partnerships with CORE. The test kits will also be available at community public health clinics. We are anticipating that there will be a maximum of 2 test kits per household, and these test kits are being provided to Fulton County residents with an emphasis on communities that have low vaccination rates and high rates of infection. However, there is a commitment to ensure that there is an access point across the entire Fulton County area. The federal government has signaled that they will be procuring 500 million test kits. We are waiting for some additional direction from them as to how consumers will access those test kits. Right now, what has been shared is that the delivery mechanism will more than likely be direct to consumer through a government website. The quantity per household has not been established as of today. We are also tracking the 50 million test kits that will be distributed to federally qualified health centers. In Fulton County, we have approximately 10 local federally qualified health centers, and those federally qualified health centers, again, will be access points for the community. The federal government has also signaled that there will be provisions in the private health insurance policies that will allow reimbursement to consumers for the purchase of at-home test kits. We do not have any other information as of today regarding any type of target population for the federal government distribution. In light of what we're continuing to read and hear about the test kit access issues, the county is in the process of procuring 46,000 additional test kits. And our goal here is to ensure that we can continue to provide an access point for constituents. We know that lines are continuing to be long for consumers to access testing. We know that some of them are continuing to experience challenges with available appointments. You've already heard today that the positivity rate is well over the 10% threshold. And as I said, I'm sure many of you are hearing from consumers about cost issues and access to home test kits. With all of that said, we are tracking to have our 46,000 test kit, the additional shipment shipped as early as today. We're already in the process of paying for those additional test kits. We will distribute those test kits in partnership with the many community partners who have vulnerable populations. We'll also ensure that we have access points throughout the county as well. We're also in conversation with our Ryan White program to procure test kits for people living with HIV/AIDS, as well as procuring test kits for our providers that are serving our homeless population using our ESG dollars. So again, the county has its eyes on this challenge, and we are readying ourselves to distribute these at-home test kits and make them available for constituents throughout the county. Mr. Chairman, that concludes my update.
All right, Mr. Calamar, anything else?
At this time, sir, we'll be here for questions.
All right, mayors, commissioners, questions. Can you see? Commissioner Hall?
Here, I just want to read something that was sent to me from a resident who is listening and watching this meeting as it relates to my question about reinfections. Their doctor told them that you can be reinfected within 3 months. The antibodies are good for only 3 months. They don't know all the reinfections because home testing isn't being monitored and reported. Even being vaccinated and boosted, the reinfection rate is like that. And this is also says reinfections can and have happened even shortly after recovery. The researchers said, and they will become increasingly common as immunity wanes and new variants arrive. So that's what their doctor told them. Thank you.
Mayor Williams? Mayor Williams? How do we get it?
Mayor Williams, I believe you're muted, sir.
Thank you, Mr. Chair, and want to say certainly thanks to Matt and Doug, and certainly Dr. Holland as well for being on the call. I would like the county manager to speak, and also any mayors to speak as it relates to what are you doing in your specific cities as it relates, and the county as it relates to operations. I know we have taken the posture in Union City to move towards teleworking to make sure that not only our staff, but the citizens are protected in light of hearing all of this troubling news around the continued aggressive nature of Omicron. Just wanted to get an idea where everyone else is on that level regarding protecting the community with, and also your staff members. I do know non-essential staff in Union City, we have moved towards a full teleworking opportunity, but I wanted to know what some of the other cities were doing, and certainly what the county plans to do over these next couple of weeks.
Mr. Manager?
Yes, sir. Mayor Williams, thank you for that question. We have recommended to our board Wednesday to essentially remain status quo from where we were a couple of weeks ago. So that would include senior centers remaining closed, but with wellness checks and virtual programming. Our libraries, we would keep open for the time being, although closely monitoring staff levels and staff impact there before we would move back to a curbside only. In behavioral health, that's again more of a virtual set of offerings with wellness checks. In the court systems, we're moving back to virtual only for jury trials. And then on the administrative side, moving to teleworking wherever possible. The only change in the tax commissioner office has been a temporary closure of the South Annex and getting folks to take advantage of Greenbrier as the alternative location. Of course, we went back to requiring masks internally upon entering our buildings a couple of weeks ago now. So that's the status of our operational approach.
Any mayors want to chime in at this time? All right, Mayor Reed, you're next.
Mr. Commissioner, I was just wondering if we could ask that the information, like the information that Mayor Gilvin asked for on masks, we're also getting questions like that just about vaccinations, the efficacy of vaccinations, period. And it'd be good to have a package that had links to the peer-reviewed data that everybody is asking for to try to get people past their vaccine hesitancy. And I would hope that the folks on the call might be able to compile something like that in a way that would be easier than it would be for us to do.
Okay, thank you, Mayor Reed. Are there other questions at this time? Anyone?
I have one other question as it relates to the tax commissioner's office. You know, we all know taxes are due. What type of process is in place for a lot of our folks who just probably don't want to go to the tax office if they don't have access to online operations? Are we giving them some type of grace period?
I guess the answer to that would be not without state approval. I think when COVID impacted, there was a grace. I'm turning around and asking Sharon. There was a grace period, but I don't believe in this case there isn't. And so we can't do it unilaterally.
Right. You know, I just wanted to know, has that been a discussion with the tax commissioner and as it relates to and him having a conversation with the state about that? Because, you know, we got a lot of seniors who may find it a little challenging for them to come and pay their taxes. And many of them don't have access to online opportunities. I was just interested in that because I know that's going to be a growing concern. But thank you for sharing that. And for those who don't know, rest in peace, Academy Award winner Sidney Poitier.
Mr. Chairman.
Mr. Chairman.
Go ahead.
Commissioner Abdul-Rahman. Commissioner
I have a
House.
question too, Mr. Chairman.
No, Commissioner Houseman, you have the floor.
Thank you. I was trying to raise my hand. For some reason, the feature's not working today for me. I saw a news report this morning that basically with the difficulty that there is with a lot of folks getting testing, and we understand that, that if you have any symptoms of a cold, that you should assume that you have COVID and act accordingly. And I'd just like Dr. Holland to comment on that, please.
Well, I didn't see that news report. I do know that was the advice given out at a neighboring county, but it is not the official position of DPH, and it is not the official position of the Fulton County Board of Health. You know, if you have symptoms of COVID, we would like you to get tested. Now, that said, in general, if you have any sort of respiratory illness, whether it's COVID or not, it's generally, you know, good practice and just common sense that you wouldn't want to expose a bunch of people to your illness. So, you know, just even if you have just a cold, or especially if you have something that's worse, like the flu, you know, stay home while you get better. But we do want people to get tested, whether that's at one of the testing centers, at, you know, CVS, Walgreens, through a home testing kit, whatever. We do want people to get tested because it is kind of important to know.
Thank you for that. I understand that it's not an official position, but it does seem like a reasonable thing for folks to do, to just, you know, try and lay low. And also, before I leave the floor, I know we've got a lot of new mayors, and I just want to welcome everyone to the group. And appreciate your service and look forward to working with our former mayors, current mayors, and our new mayors. Thank you.
Mayor Bodie.
Thank you, Mr. Chairman. I'm just going to hop back to Mayor Williams' comment about the tax commissioner's office. Of course, you know, I believe, and Mr. Chairman, you'll know this better than me. I believe our taxes, most of them were due back in October. So it's not real pressing right now on the property tax situation, where the problem at the annex comes in down there for us is tag purchases. And, I can remember the last time that this happened, and I'm sorry that Arthur's not online. I know he was on here the last time, but, redirecting all these folks out to Greenbrier, is a terrible inconvenience. You not only got all them folks that are already lined up out there, but now you're going to put us out there with them. And it's going to, be a tremendous weight to just update your tags as your birthday comes along. So just a little clarification on that from Mayor Williams. Thank you.
Thank you, Mr. Mayor. Commissioner Abdul Rahman.
Thank you, Chair. Thank you, Mayor Bodie and Mayor Williams. Even though I cannot speak for the tax commissioner, we, on a case-by-case basis, out of the District 6 office, as with the annex, have been working with the tax commissioner, with the senior community, as to what the county manager stated. There, even though at the state level, there has not been a waiver of fees. However, the tax commissioner office has worked with my office when we've had especially some seniors that for whatever reason there was a miss in date or whatever, they couldn't get in or however it happened. And on a case-by-case basis, we have been able to resolve some issues through my office. Now, having said that, to all the mayors, but especially the ones that I represent, I would encourage for us as sitting commissioners to make sure that we fall in for the gap. Because I know, in particular in my district, yes, you are correct, Mayor Bodie, that is presenting a challenge and a hardship to expect us to go all the way to Greenbrier. However, the Mighty Six office at that South Annex is open with the assistance to the kiosk. And so at any point, if there are any seniors or any individuals that need some assistance that we can do through that office there, because that's the reason that office is there. The taxpaying citizens own that office and it is open. We are doing basically social distancing, but I have since actually been over there myself and stood at that kiosk to walk people through anything that can be done at that kiosk. So I just wanted to make sure that the mayors, especially in my district, to know that that office is available to you as a conduit to the tax commissioner's office for anything that we can assist to get done while we work through this. I know it is very hard, especially before when that office was closed, but we have to understand, safety first. But here it goes again to what I stated earlier. We have to have a out of the box working plan for individuals that cannot go all the way to Greenbrier. And so I would encourage, and I know my colleagues would do the same. So I would encourage all of the mayors, especially the ones that I represent, please reach out to me and allow my office to do any and everything that we can to coordinate with the tax commissioner, or if it's something as simple as assisting them at that kiosk, we will be more than happy. Thank you.
Thank you, Commissioner. Are there other questions or comments on this section? Other questions or comments on this first section? Nobody? All right, thank you.
We'll get a quick update on.
Oh yeah, Dr. Rochelle, are you still with us?
Yes, sir, I'm here.
All right, can you give us a quick update on the emergency rental assistance? And that's probably very useful for the new mayors. You might want to emphasize that we've been, I guess, a leader in the country with respect to using all of our money, and to the extent that I personally contacted the governor to ask him if Fulton County could not have some of their money that they had not used, specifically asked for 25 million, and it looks like we're going to get to 25 million. So, Dr. Rochelle.
Thank you, Mr. Chairman. So as the chairman indicated, Fulton County has been a leader in the country on the administration of our emergency rental assistance program. We have exhausted $42 million in our first and second wave of funding. The board generously approved $4 million additional dollars for us to continue adjudicating applications in anticipation of the $25 million ask that the chairman just referenced. This $25 million is a reallocation from the Department of Community Affairs state coffers from their emergency rental assistance program. As the county manager indicated, he did receive notice that the reallocation was approved. We also have received notice from Treasury that the reallocation has been approved. We are waiting for confirmation of the exact dollar amount. When we do receive those funds, we will continue to administer the program. We are still accepting application through our application portal, and we are still accepting calls through our call center. So we are continuing to administer this program. We also continue to have a focus on eviction mitigation, and we are in partnership with Magistrate Court and actually have staff stationed there during court proceedings to expedite rental assistance applications and payments to prevent evictions. So we are looking forward to continuing this successful administration of these program dollars and continuing to lead the country in this effort.
Any questions of Dr. Rochelle? No? All right, thank you, Dr. Rochelle. All right, next would be elections. Very quickly, 2022 elections are fast approaching. And once again, I think Georgia, but more specifically within Georgia, Fulton County will be the epicenter for obvious reasons. It's already started. So we need to be on our best behavior, so to speak. Qualifying is set for March 7th through the 11th, and primary elections are scheduled for May the 24th. At our meeting on the 5th, we set the fees for the various offices. And so we're working internal to county government, which includes the Board of Registration and Elections. We're working, getting geared up for what I believe will be another very successful election in Fulton County. But we are already trying to identify sites throughout the county, as well as poll workers. And what I will be recommending is that we contact each mayor, so you will have a chance to look at the sites that we've chosen, have been chosen, not we, but have been chosen in your jurisdictions. And number two, with respect to poll workers, we always hear that some mayors and some citizens say, well, we have 10,000 poll workers available, we're never contacted. So my challenge will be to the mayors to ask each of you to commit to identifying in your particular city people who will commit to working with us. This is a very complicated process, and I want to make sure that everyone has an opportunity to have whatever input he or she desires, but specifically with respect to polling sites, and number two, poll workers that you can identify. So you want to add anything, Mr. Manager?
The only other thing I would add, I know many of you may have heard from constituents relative to the temporary staffing firm that we use, Happy Faces, and we are working with the Board of Registration and Election to look at how we lessen our dependence on one firm. So expect us to present in the next week to the Board of Commissioners for their consideration, a plan that would begin to attempt to hire folks, probably in the neighborhood of 50 to 100. Also look to other staffing firms which are on state contracts that could potentially be readily available to us, whereby if we feather in personnel from those firms, as well as hire, as well as maintain a relationship with Happy Faces, we'd have a more diversified set of resources. I think what's not realistic is just to flip from one to the other. And the reason is just the scale and scope of what's involved. There's about 800 folks that we use from temporary staffing firms out of 4,000. So first and foremost, no firm is running Fulton County elections. Fulton County is running our elections. And with 80% of the folks being volunteers that the chairman just spoke to. So it's a misconception that any one firm is running our elections. But number two is the personnel that we do get from temporary staffing are used for months at a time. We've now got the Board of Registration and Election to detail each one of those functions. That will also be presented to our board in the next session, where there'll be transparency and clarity about where those functions are staffed by temporary workers and for what period of time. And as you can imagine, it's not a simple matter to ask someone to commit to months at a time as a volunteer. Election day, yes, but when you start talking about volunteering for 6 months, 7 months, 8 months, that's not a practical solution. So that all being said, I think we can strengthen our approach, better contract management, a more diversified set of suppliers, and have something that's for the Board of Commissioners and then ultimately for the constituents, a improved approach as we make our way through this election.
Mayor Gilvin.
Thank you, Mr. Chairman. I wanted to first thank you and the rest of the commission and staff for bringing this up. I think it is critical, and I appreciate the fact that y'all recognize that, you know, all of us, no matter where we are in the county or who we're rooting for in the elections, it's critical that all of our residents believe that these elections are conducted fairly and professionally and appropriate. So I appreciate y'all introducing that in this conversation and letting us know. I'll ask, how many people do you think you would need from the volunteers in the cities?
Well, I guess the general question would be as many as possible. We'll have, for example, historically, we may have 10,000 people at any point in time who say, I want to volunteer, I want to volunteer. You call them for training and you lose half of that 10,000, then you're down to 5. Then when it comes time to the training day, you lose another percentage. And even after you get them trained, week before they're needed, another percentage will drop out. The day before the election, another percentage will drop out. So it's a complicated matter. We need to have as many as possible, and we have so that when these dropouts do occur, we have people, trained people waiting to fill in. So that's why I think it's going to be important for the mayors to help us, because there's this school of thought, and it's not a school of thought. I've been told by a group of citizens who come to our BOC meetings, every meeting, to talk about this issue in general and specifically, that there's some requirement someplace. I've asked for documentation of that for 2 months now. I haven't gotten it. That there's a rule or a policy or something that requires that poll workers come from within their communities. If that's true, I want to comply with that. And if that is true, the best source of getting those live bodies would be the mayors and council members in those cities. That's why I'll be asking for each mayor and members of council to provide us with as many as possible. I don't have a magic number, but I would say that generally speaking, we can use as many as you can identify.
Thank you, sir. And I'll make sure and send emails to all those people that have been emailing me asking for their volunteers. And just one other thought that I had, I know we're in the year that we need to renegotiate the loss distribution and service delivery agreements and things like that. and so that it could help us on the local level. Has the county given any thought to the timeline you would like to follow on that process?
We have not discussed with our board yet, Mayor Gilman, a timeline for loss, but it is definitely on the radar screen. And so give us perhaps 30 days or so. We'll try to come back to this group with a proposed timeline.
That's fine. I mean, I encourage all of the individual cities to start having those conversations. And I have with our staff and maybe some of our neighbors, but I just thought it would be helpful if we go ahead and establish a timeline, since we've only got 12 months to get this done.
Sir.
Thank you, Mr. Mayor.
Thank you.
Commissioner Abdul Rahman, followed by Mayor Bradbury.
Thank you, Chairman. I just wanted to take this opportunity, especially when we're dealing with elections and registration, just to not only confirm what our county manager states when it comes to our elections. It is a complicated process. Volunteers are more than welcome, but as a law and as we have to operate, we have to have a certain level of individuals on staff. And I know for a fact, having ran several businesses and campaigns, or just something as a PTA president of my local school, volunteers will be committed, but they will be committed according to their schedule, not the schedule of the commitment, because any and everything that could happen will happen. Now, having said that, I think that we should incorporate volunteers. I think we should make sure that our community is part of the process from one end of the county to the other. But I think I would be remiss if I didn't say that we need to understand that elections need to be ran correctly. They are being ran correctly. There's no fraud at Fulton County. Do we have processes and procedures that we probably could fine tune and make better? Yes, but that is a way of life for everyone. But there is no fraud going on. And I want the mayors on this call, all the mayors, to know that I am committed to making sure that the election process is unfettered, that is fair. It is done on all areas of Fulton County fairly, and make sure that it does not become a burden or something that one end of the county seems to have a problem with versus as the other. We are one Fulton, and that is my commitment as a sitting commissioner. Even though I'm a district commissioner, I report to all of Fulton County, and I know that several mayors have called me with concerns. And so I just want to openly in this forum with the mayors to let you know there was no fraud. However, we do have things we need to do better. We do need processes that are better, and we need to have communication that is better. And so, and I believe all my colleagues believe that. And so at the end of the day, I am here to serve all of Fulton County, and I am here to make sure that these mayors know that the election process at Fulton County is one that they can be proud of. Thank you, Chair.
Thank you, Commissioner. Mayor Bradbury.
Yes, Mr. Can you hear me?
Yes, sir.
Okay, great. I'm trying to get back into the Zoom swing of things. One, I appreciate this opportunity in this conversation, Mr. Chair. Wanted to find out a little bit more, somehow the mayors are being put front and center on administration of Fulton County elections. I am happy to work with the commission and the Board of Elections in any way possible to muster additional volunteers out of Johns Creek and anywhere else in Fulton County. It is a little bit of a curveball in the sense that on one hand, we've got people that are saying, well, hey, why not have the city administer their own elections? And in some ways, this idea that the city mayors would be responsible for providing these volunteers, it seems a little bit like we're kind of at cross purposes in a way. Mr. Chair, when you talked about happy faces and the percentages, am I reading between the lines correctly that the ability to wane ourselves off of happy faces is being tied to the mayor's ability to muster a considerable number of volunteers?
No, sir. Mr. Manager?
No, I didn't mean to conflate that, Mayor Bradbury, if I did. So separating.
No, I don't think you did. I don't think you did necessarily. It's just that we are kind of having a very new kind of conversation. As far as I know, I mean, this is my first mayor's meeting, and so I appreciate again the opportunity, but I am trying to get a little bit better clarity on what exactly the expectations are, both on our side and on your side, including, if we're talking about diversifying the subcontractors and the personnel, what percentages are we talking about? Are we talking about reducing down to 10% or 50%?
Yeah, let me take maybe another shot at that.
Sure.
And I'll try to be more succinct. Running the total election requires about 4,000 people.
Okay.
80% of those are volunteers. And that's what the chairman was speaking to, that every mayor, and by the way, this is an initiative actually proposed by the mayors, could
volunteer, they're paid.
Well, yes, but they are volunteers, but they are reimbursed, but nonetheless considered to be community volunteers in large degree. And this was offered up by the mayors in a previous call, that mayors could be helpful in identifying, soliciting, and helping recruit that broad number of 4,000. Inside the 4,000, about 22%, or again, using round numbers, let's call it 800, is a temporary staffing model that operates for months at a time. So some are in positions for 6 months. Those may be people that are managing the receipt of absentee voting ballots. It could be folks that are operating for 3 months as technicians at sites. So there's a variety of functions that don't comport with what you consider the typical poll volunteer. They have skills and, again, months worth of commitments, much what Commissioner Abdurrahman was referring to. Within that subset of the 4,000, so about 20% of the 4,000, is where I think it's more of an internal to Fulton County initiative to diversify the dependency that we have had on one provider, Happy Faces, to include both internal staff that we would recruit, and that's the number I threw out of perhaps 50 to 100 of the 800 we would try to recruit as long-term Fulton County employees, and then look to the state contract for alternative providers to Happy Faces, which would obviate not having to rebid an entire contract, but would allow us to diversify the providers that we currently have for that group of 20% that, again, operate more as, again, long-term folks engaged in the election.
Okay, very much appreciate that information, and I'll follow up with some detailed questions about exactly what I can do and John Street can do. My other thing that I wanted to say, I very much appreciated what the commissioner had to say before me, and then also Mayor Gilvin. Obviously with our elections, whether it's at the county level, what we're looking at nationally, people have different views of what happened or is happening with our elections, but I think everyone agrees that it's of paramount importance that the perception be that the elections are as tight as possible. My predecessor, you all are, most of you I think are very familiar with Mayor Bodker, I know that he had particularly strong feelings about the current head of the Board of Registration and Elections. Can you speak to what is the plan, an exit strategy for Mr. Bannon, and if there's an extension, why that would be necessary?
So you want me to try? So factually, Mr. Barron is still employed as it's titled Director of Registration and Election. He had originally, by way of background, because the term that I use was a distraction. And what I mean by that, let me back up even further. I believe that Richard Barron is a professional, and he knows as much about running elections, and we're going to find this out, as anybody in the country. But is he a good manager? All of this remains to be seen. I don't want to say too much publicly because he's been berated publicly, and in fact, if he were to, hopefully he won't, take some action, I could probably win the case for him, and then never been one day at law school just by listening to some of these tapes. But the Board of Registration will actually back up even further. Meeting with him because of what I consider to be, as long as he is was in that position, is in that position, there are going to be those who want him gone. Public officials, elected officials, private citizens, you name it. So we negotiated an agreement with him whereby and convinced him that it would be best. Based upon that, he drafted a letter of resignation effective December 31st, 2021. In the meantime, we're getting in preparing for the 2022 elections. Decision was made by the Board of Registration and Election. They also talked to me and probably talked to others that running an election is a complicated matter. And finding a replacement for him is going to take some time. Case in point, our sister county, DeKalb County, they have been searching nationally for a director. In fact, they approached Mr. Barron about coming and work for them. He enjoyed working here, so he turned that down. They've had to extend their search, still looking nationally for an elections director. Mr. Barron then was asked by the Board of Registration and Elections to stay on to assist. So they then voted, I think it was 3 members vote, 3 of the 4 voted yes. 3 of the 5 rather voted yes. 1 abstained and 1 was absent. To ask him to stay on until April 1st, is that right?
Yes.
Until April 1st. My opinion, our primary election is May 24th. So to me, logically, if he was going to, or if he's going to stay on, it should be after and get us through the May 24th primary at a minimum. While we're preparing for that, the Board of Registration and Elections is going to conduct a nationwide search for his replacement. In the process of doing that, trying to find a search firm, the firm that they wanted to use was conflicted because it's the same firm that is conducting the search for DeKalb County. So at that point, they had to start all over again and going through our processes, which is what they're doing now. We had to go through purchasing, HR, et cetera. So there is now a search. In fact, I'll just tell you this, because of it, to me, I view this as an emergency situation. We need someone in charge there on a day-to-day basis. So the search is ongoing as of not yesterday, today. a national search to replace Mr. Barron. In the meantime, he was still employed in the department until April 1st, unless those circumstances change. The other thing that's underway now is that the Board of Registration and Elections is looking internally and throughout county government for an interim director while all of this is going on. So I think it's approaching a point where it is an emergency and we need to have someone in place running that ship. So that's really, did I leave anything out? That's really where we are now. The other complication with respect to the, well, I guess not a complication. Anyway, that's where we are now.
And is there, and I don't mean to take up so much time, but is there an assistant director in place that is able to act in that interim capacity?
Well, you asked two questions. Is there an assistant in place and capable of and I can't answer that, but yes, there is an assistant or deputy. What was his title? Deputy director. There is a deputy director. And the second part of that, I'm not in a position to answer that question.
Thank you.
Thank you, Commissioner Hausman. Okay, Commissioner Abdul Rahman, followed by Commissioner Hausman.
Thank you, Chair. First of all, let me apologize to our mayors. Okay, and some may not like me doing this, but I'm going to do it because I think it's necessary. And the reason I'm apologizing, you all saw a press conference that Richard Barron would be leaving us by December 31st. Okay. And so, of course, given what the chair just said, he's a distraction, and that not a distraction as to whether his qualifications or not. I don't even want to get into that. That's not important to me because I have been crystal clear as of the last board meeting. It is not about his qualifications. It's about what we have presented to you, the mayors and the public, that he would move on. So we owe you all an apology because if he is not moving on, we need to let you all know why, which the chair has just done. However, what I will say to you as a sitting commissioner that is concerned with SB 202, that's concerned that if we do not handle this correctly, that we will have done a disservice to the entire Fulton County. So it is important that a search that should have already been on the way is underway per what the chairman just said, but we need to be crystal clear and focus on this search. And the reality of a search is it usually takes multiple candidates, and it usually takes several meetings sometimes to get that quality candidate. And so it would be a disservice to our community to say, well, he needs to be gone by April 1st if we have not committed to this community a replacement, a search plan that has given an update on the replacement, or an interim that has been named and vetted. And so I cannot speak for the rest of my commissioners, nor will I even do that. But I will tell you as a sitting commissioner myself, I believe that our search should be underway. It should be done very carefully and make sure that we get the best candidates. And also the search should be tied to him leaving. The search upon us having a viable person in that position, he should leave. And if that can be done before April, because you're talking about a month before the elections, that's my personal concern. But more importantly, anything that we do that could be perceived as destabilizing our elections, I am vehemently against. And so what I would say to my mayors is, I do apologize for what I see as a dropping of the ball. because we were all under impression that he was out of the door December 31st. But upon having further review with the Board of Registration and Elections and talking with them and finding out that there was some other issues at play, this is now where we are with the April 1st date. What I would like for my mayors to know is that I will be working closely to monitor this and make sure that we do not do anything here at Fulton County to destabilize our elections. And more importantly, we need a new person, we need a new candidate, and that takes time. And anyone telling you something different or giving the impression that that would be different is not being honest. And so I just wanted to make sure that our mayors understand that something did happen and we need to apologize and make sure going forward that we're all on the same page. Thank you.
Commissioner Houseman.
Actually, I think you had me in the queue from the previous topic. My only comment is, and we discussed this at length at our meeting on Wednesday, so I'm not going to repeat what I said. We took a vote. It did not change anything on the status of the elections director. We did not honor the request of the Board of Registrations and Elections that was given to us. That being said, Mr. Chairman, I think you made a comment that I think was a slip of words in that we had negotiated the resignation, the original resignation. And I just want to state for the record that I wasn't a party to those negotiations. I don't think that you meant to say it in that way. And
you're correct. I hope I didn't. I said I should have said I. I met with him, and I'll just be very specific with you. It was a Sunday morning before our meeting. I met with called him to a meeting at the International House of Pancakes. I can give you the address on Peachtree Road with Kathy Woolard to talk to him. I had nothing to do with his credentials, his qualifications, but as long as he's there, are there going to be those who are going to be every meeting is the same group, every meeting there, public officials from all over calling for his head. And so as long as he's there, I think it was working. I mean, I used the word distraction. And it was also impacting his health. If you remember during the last election for a day, he had to go to the hospital. And I think it's still impacting him. He has a 13-year-old daughter. I don't want to get too much in this, but for her to continue to hear this stuff, that's why I say if he were to take some action, I could win the case for him. But I did not mean to say that the board negotiated with him. I, along with Kathy Woolard, who was the head of the Board of Registration and Election, talked to him and explained just the facts of life, so to speak.
well, again, he resigned on his own.
Yes.
And it was not a thing that was, he was not instructed to do so. I just want to make that clear to the public. The only other comment on this topic is, we've gone round and round and round about our staffing of our elections for 2 years now. And my position is well known. I think that we should be using community members as much as possible to conduct our elections because they know the members of the community when they come in to vote. I just think it's better in every way that we utilize folks in the community that are also dedicated, as we are at Fulton County and our government, to providing elections that people can have confidence in. And that's the goal here. We're making progress. And I certainly hope that we can come up with dedicated community members that will help us conduct our elections going forward. We've been asking for it for a long time. Thank you.
Thank you, Commissioner Vice Chair Houseman. Commissioner Ellis?
Yeah, just real brief, and I want to apologize to our mayors too, just to say that I think a bit of this discussion is probably has not been appropriate for this meeting and really should be reserved for a different type of forum given its personal nature. So and I do think some of this discussion, has been out of bounds. And I think hopefully going forward when we're discussing this, if we have specific information, we can provide it to you. And if we have specific asks, we can make those of you. That this not turn into a personnel discussion. That'd be my ask going forward.
Anyone else? Other comments on the elections? And again, I'll put my request in writing that we're looking for assistance from you in whatever way possible. 2 areas, polling locations and live bodies. All right, third item would be Mr. Manager.
Mr. Chair, if I may.
Good. Hey, Commissioner, how you doing? How you feeling?
Feeling fine, feeling fine. I just wanted to say that I want to thank our staff and personnel and volunteers and everyone that works on our elections. We have the largest county in the state, and they are not perfect, but they do a good job. We have Republicans and Democrats alike that work in that capacity. Our county manager wrapped his staff and his team around our elections department to make sure that our election went well. Was our election perfect? No, because it is run by humans. But everyone did a good job. Everyone acted in good faith. And me personally, I'm not giving any oxygen to the big lie. We have to make sure these people are in place. That 80% of these people are volunteers. 80% are volunteers from the community already. Anything else is a part of the big lie. And I am not giving it any oxygen. And you can give it oxygen if you want to. But anything else is a part of the big lie. We have quality, competent staff that do their best to make sure that we have fair elections. And those staff members are Democrats and Republicans alike. And they do a good job, and they have done a good job. Have there been errors or mistakes here and there? Certainly there have. But our staff overall, in general, and our volunteers, our community volunteers, which comprise 80% of the people working on election day, have done a good job. So let's be real clear, because a lot of this is a part of the big lie. A lot of this pushback, and they can come down as many times as they want to. I don't care. It doesn't matter. It's irrelevant. They have bought into the big lie, and they can come down and repeat the big lie as many times as they want to. It's not going to change my opinion about the big lie. The election was fair. Our Secretary of State, a Republican, stated that our election was fair. Our governor stated that our election was fair, who's also a Republican. So, everything else is a bunch of hogwash.
Thank you, Commissioner. All right. Next item is the discussion of the T-SPLOS Oversight Committee or Council, Mr. Manager.
Yeah, so briefly, I think David Clark is on here, and this is just to ask for you to submit your citizen for consideration for the council, or your person that you're naming for the Oversight Council. We thought that we should have this in place before the new T-SPLOS program begins, but as we went back and looked at the IGA, it actually, to comply with that, needs to be in place 90 days subsequent to the vote. So really by February the 1st, we would like to have your name of your individual, and it can be an extension of who's already on that committee, and it's one per city. David, did I leave out anything? And I think you've revised the note to the mayors with a February 1 date. I just want to clarify that for anyone and answer any questions. David, did I leave out anything?
No, and those revised letters went out on Tuesday of this week, so hopefully everybody's got them in their mailbox by now.
Any questions about what's being asked here? Okay.
No, sir.
Thank you. And then lastly, unless there's something else, the 2022 meeting schedule, we meet monthly, the first Friday of every month, beginning at 10. Typically, we're done by noon. It's about 20 till noon today. So I'd like to propose that we continue to meet first Friday of each month, beginning at 10 a.m. until such time as we decide that maybe we don't need to meet as often as we have, but we're still dealing with the COVID-19, and we have an upcoming election. So I think it's important for us to continue to meet, to stay in touch with each other. Commissioner Hall, that will be my recommendation. Commissioner Hall.
Thank you, Mr. Chair. And via text this morning from Mayor Andre Dickens, he stated that he didn't receive today's meeting invite and information. So if we could just ensure that he receives the meeting invite for the first Friday of every month from 10 to 12 with the agenda, he would greatly appreciate it. He does want to participate.
He has indicated his willingness to participate, and that's welcome news.
Yes. Thank you, Mr. Chair.
Other comments? Any objection to us continuing to meet? Commissioner Ellis. Commissioner Ellis?
Yes. Also, I think there was a snafu in Mayor-elect. I'm not sure he's mayor just yet. Kurt Wilson was not provided access to the call as well. So I would ask that our team get in contact with him and make sure that so we don't have that omission going forward.
Madam Clerk, did you hear this? Madam Clerk? Well, I'll communicate.
Yes, sir.
Okay. Mayor Brett, and is it possible to provide the two mayors who were not informed a copy of this meeting today? Is that possible?
Yes.
Okay.
Yes, it will be online, and we can also forward them a copy as well.
Thank you, Madam Clerk. Mayor Bradbury?
Yeah, Mr. Chair, it sounds like we're on the verge of concluding the meeting. I just wanted to say thanks again for. Am I on mute?
No.
Can you hear me?
Yes.
Can you hear me?
Yes.
But wanted to thank you and Dick and Harriet for visiting Johns Creek. We had the pleasure of hosting y'all. I think it was yesterday or the day before.
Yes.
And enjoyed the conversation. Johns Creek and I are looking forward to working with all the mayors and all the commissioners.
Thank you, Mr. Mayor. Yeah, we're making the rounds just to extend a hand of welcome and friendship to all the new mayors. We have, I think, a couple scheduled, the final two scheduled for next week. Just to say that we're very proud of the work that we do here at Fulton County. I have a hard working board of commissioners. Don't always agree, but our goal is to, when we disagree, to do so agreeably, but also to work in partnership with each of the cities, each of the mayors, and each of the councils. And I think together, we're going to continue to do good things. I don't think there's a better county, a better run county, with maybe a couple of exceptions, of the 3,000 plus in the United States of America than Fulton County, Georgia. Anything else to come before us today?
One thing, Mr. Manager, I just wanted to,
Mr. Manager.
As the manager, I wanted to recognize, excuse me for that slip up, Mr. Chairman, recognize Mayor Still, who had his mom pass away over the holidays. So Mayor Still, we all are in prayer for you and your family.
I do appreciate that, Dick. Thank you.
And by the way, as I said earlier, Commissioner Arrington had surgery, so let's hope that he recovers quickly. Any closing comments?
Yes, sir. It sounded like Commissioner Arrington has recovered. Thank you.
All right, no further business to come before us today, and we are adjourned. Thank y'all so much.
Thank you.
Take care. I love you. There ain't nothing you can do about it.
Everyone have a good day.